Thank you, Chairperson, for a kind introduction. Good evening, everyone. I'm Choon Hian. It is my pleasure to be invited in this conference to share about innovations and technologies in fall preventions. Falls are the leading cause of injuries in older adults who are aged 65 years and above. A serious fall can result in decreased functional independence and quality of life. The risk of falling increases with age for many reasons, including overall weakness, frailty, balance problem, cognitive problem, vision problem, medications, acute illness, and other environmental hazards. There might be no ideal instruments or calculator for us to decide who is at the greater risk of fall, but we still have a wide range of falls prevention interventions and associated systems which aim to overcome falls and the risk of falling. These falls prevention intervention systems are broken into three divisions: pre-fall, post-fall, and fall injury prevention intervention system. First of all, in the pre-fall prevention intervention systems, there are the technology applications that focus on supporting the older adults who has yet to experience a fall, but may be considered to be at the risk of falling. They take a proactive approach through the development of application, which support the delivery of the physical activities, exercise, and education programs. Besides that, cognitive training programs are also deployed in order to encourage the older adults to engage in the activities that to stimulate their cognitive and hence slowing down the age-related onset of the cognitive decline. On the other hand, in the post-fall prevention intervention systems, they are the applications of the technology which focus on the individuals who have already experienced a fall and aim to assess and also to deliver the intervention systems, which is to reduce the risk of falling and to reduce the repeated falls episode. For example, these post-fall intervention systems includes the diagnostic assessment, such as the functional assessment and the cognitive assessment to assess the fall intrinsic risk factor. Also, it contains of the environmental assessment, which is to assess the extrinsic risk factor. Then, when we move to the falls injury prevention intervention systems, it will focus on the adults who are likely and expected to fall or experience a falls in the future. The aim of these systems is actually to detect falls when they occurs and also trying to minimize or trying to prevent the falls related injury. For example, it has an activity monitoring. They are going to monitor the subject's movement obstructively or unobstructively while they perform their daily living activities. And also, this activity monitoring is also trying to detect any abnormalities. Next, we can have a fall detector, which is trying to distinguish between a fall event and from the daily activities. And then when they have a false event occurs, they will detect it and record it. And then we also have a medical assistance that involve the provisions of support provided by the clinicians after a fall. Among these, then we have a cross-falls prevention intervention systems, which are the technology application that attempt to support and deliver a combination of pre-fall, post-falls, and falls injury prevention intervention systems. For example, develop a smartphone application which assess the fall risk using the traditional clinical test, and then it will detect falls after they have occurred in order to prevent any fall-related injury. In this case, it will be a combination of the post-falls and the falls injury prevention. Next, let's talk about the systems, information source, and the interface type. The system hosts a range of the application type and also a range of the hardware platform. For example, the interactive systems, it contains of the games or such as the virtual reality application that allow the user to interact with the systems in some manner, whereas for the static one, they will offer no form of interactions. With regard to the platform, desktop computer will be the most common platform to be used. Then we can have a game console such as the Nintendo Wii and Microsoft Kinect. They are the self-contained platform in which specific game applications are utilized by the falls prevention systems so as to deliver a fall prevention related games. In recent years, smartphone has shown a promise as an ideal candidate for the deployments of the false prevention application, partly due to the advance in the processing capability, the integrated sensor, as well as the communication facility. Then, for the information sources, it will relate the range of the input that system use to sense the user and the living environments they monitor in order to provide any false prevention systems function. The sensor locations specify where the sensor are located. It can be either a variable sensor that is varied by the user, or it can be within the context of environment. For example, these environmental sensors can be either in the form of camera-based sensor or floor-based sensor. They are going to install in the living environments, which will then fed the information back to the systems about the user interactions with that environment. For the sensor purpose, it will generally divided into 3 discrete groups. It can be either bespoke, repurposed, and co-opted. Bespoke sensors are the sensors that are developed specifically for the false prevention systems, which often to gather any physiological movement or physiological data from the user. Repurposed sensors are the sensors that are originally developed for other function, but then it has been adapted for the use of the within the false prevention context. For the co-opted sensors are typically built into the popular device. For example, the accelerometers and the gyroscope are built into a self-contained smartphone, which is used to obtain the movement data. Then, all of these technologies systems can be used either in the adult homes, nursing homes, or even hospital. For the interface type, it will be either natural user interface, where the user's natural movement to be monitored and to serve as an input, gathered through the wearable device or through the environmental sensor. Or it can be a touchscreen interface in which it enables the user to interact with the false prevention systems with the touch gesture. And lastly, the false prevention systems also can be either a synchronous motion or it can be a synchronous one. For the asynchronous collaborations, for example, in the case where an older adults, they can actually, the movement data will be gathered through the wearable sensor. So if a fall event is detected, it will actually recorded and an alert will be sent to the healthcare clinicians and then to informing them there is a fall for this elderly. Whereas for the synchronous collaboration, it will actually refer to when the user movement data, it is actually gathered in real time, and the response of this movement data is also given in the real-time situations, either in the form of visual feedback or in the form of biofeedback. So the first technologies or the innovations that are going to introduce over here will be the GateUp Go, which is come from the GateUp company. It is a wearable sensor that is connected to the mobile application, as shown in the figure over here. GateUp Go is quite a perfect fit for the instrumented clinical test for the clinical use. For example, in order to measure balance, we have the Romberg test, bipolar balance, and the tandem balance. In order to measure the gait or the motor function, it consists of time up and go test, time up and go indoor task, or 5-time sit to stand test. In addition, it is also suitable to be used in the real-world conditions that can measure directly from the patient home, such as it can measure the 10 meters walking, 2 minutes walk, and also the free walk. As shown in the figures over here, GateUp Go is actually quite a small device, which is only with the dimensions of 42 times 31 times 15 mm, and it is also lightweight as well. That is only 15 grams. It consists of a 10-dimensional sensor, which are the 3D accelerometer, 3D gyroscope, 3D magnetometers, and a barometric pressure sensor. They are going to measure the altitudes from 260 to 1260 hectopascal. Other key features includes that the design is ergonomic, which consists of a powerful multicolor LED and sound, and also it consists of a large single buttons to initiate the measurement. It also have a high-end connectivity, which is the wireless connections, and also there is a USB-C connector for the mass storage and the charging. For the sustainability wise, the battery can support long recording, which is up to 37 hours of the gait measure, And also it have a 4 GB flash memory, which have a storage capacity can up to 45 hours of data. And lastly, it is also a medical grade inertial sensor, and this is actually certified by ISO and IEC standard. And then the other technologies to introduce here is also quite a popular technologies. There is a pressure sensitive floor mat, such as Gate Ride, as shown in the video over here. Gate Ride is a portable single layer pressure sensitive walkway that measures the pressure distribution under the feet and the deviations of the center of pressure when the persons perform a series of tasks. These measure parameters include both the temporal and the spatial parameters in the gait cycle. The main reasons why pressure-sensitive mats are suitable for clinical use is mainly due to the objective gait analysis, which can provide the clinical outcome measures. It can document the parameters pre and post interventions, and then it could improve the patient compliance. Next, it is exercise using computer and gaming technologies, or known as exergaming. For example, it can be Microsoft Kinect or Nintendo Wii. This exergaming device depends on the pressure and the motion sensor, accelerometers and gyroscope for the game input, control, and feedback. As compared to the traditional exercise and workout, exergames are quite accessible, cost-effective home-based intervention. They're going to focus on training both cognitive and motor skills. And therefore, the use of these technologies has recently emerged as a potential balance and physical fitness intervention in older adults. This is the example come from the Kinetic Systems. The systems allows the user to interact with the systems in a 3D environment where they perform multiple movement combinations without the needs of the attached device or without the needs of a controller. As shown in the figures over here, the device features a RGB camera, depth sensor, and multi-array microphone, which are responsible for the full body 3D motion capture, facial recognitions, and voice recognition abilities. Then, the skeleton tracking shows over here allows the user to be tracked while they sitting, standing, and facing the Kinetic Systems. All of these features allows the Kinetic device to identify a user and to detect the movement from the body. And then, this will be the last technology to introduce over here. That is the Locometrop. It is a robot-assisted therapy which enables the effective and intensive training to increase the strength of muscle and the range of motions of joint in order to improve walking. The reasons why Locomet is introduced is due to the limitations of the conventional gait therapy with the manual treadmill training, where the physiotherapists may be suffer or exposed to the physical strain, and sometimes it can be more than one therapist is required, and there's a limited training duration and intensity. Therefore, as we can see from the video, Locomets cover most of the physiological movement. The physiological movement of the lower extremities is ensured by the individually adjustable patient interface. Also, the hip and the knee joints angle are adjustable during the trainings in order to meet the patient's specific needs. Besides that, especially during rehabilitation, patients need to be challenged. Then, physiotherapists actually can help the patient to reach their goals by setting the training parameter according to their performance. As shown in the videos over here, the systems also incorporated with 19 game-like exercise that can motivate the patients to reach their goal, which is known as Augmented Performance Feedback, or APF. Study have shown that when using this APF, the muscle activations can be considerably increased. With Locomet, physiotherapists, they can better focus on the patients and the actual therapies. Then it will enhance the staff efficiency, safety, leading to the higher intensities of the trainings, more treatments per therapies, as well as it will be more consistent and provide a superior patient care. In summary, we can basically divide all of these innovations and technologies into 3 tiers. Tier 1 is for assessment purpose that allows all the adults aged 65 years and above. The current resources available are the multifactorial evaluations, type and go test, or sit to stand test, and etc. Then, with technologies and innovations involved, we can have a body-worn sensor, get-up-go, smartphone applications, and the pressure map. Then, when we go to Tier 2, it will be on prevention base. That is to prevent the adults who at the risk of falling, but with no previous falls. The current resource available is the exercise, yoga, and Tai Chi. With technologies and innovations, we can have the exergaming, wristband sensor, and shoe sole sensor. And lastly, in Tier 3, it will be on the intervention base. That is focused on the adults who have experienced a fall before. The resource available will be the physical and the occupational therapy, otago exercise, and Tai Chi. With the technologies and innovations, we can have the V-time treadmill therapy, Locometrop, Reward, Indigo, and etc. Last but not least, I do believe the advancements of technologies and the appropriate use of technologies could bring a better quality of life to the older adults. This will be the end of my presentation. Thank you.